Can you drink alcohol while taking allergy medication? It's a really common question, and the honest answer is it depends on which medication you're taking. But for many antihistamines, the risks are more serious than most people realise. Before we dive in, just to be clear, this video is for general information only and isn't a substitute for advice from your own healthcare professional. Always speak to your GP or pharmacist about your specific situation. Right, let's start with the most important distinction: first generation versus second generation antihistamines. First generation antihistamines include medicines like chlorphenamine, you might know it as Piriton, as well as promethazine and diphenhydramine. These older style antihistamines already cause drowsiness on their own. When you add alcohol into the mix, both substances depress your central nervous system, and the effects don't just add together, they amplify each other. We're talking significantly increased sedation, impaired coordination, and much slower reaction times. The NHS advises avoiding alcohol entirely if you're taking one of these medicines, and the MHRA requires that products containing these ingredients carry explicit alcohol warnings on the label. If you see that warning, please take it seriously. Second generation antihistamines, things like cetirizine, loratadine, and fexofenadine, were developed to be less sedating. Generally they are, but that doesn't mean alcohol is completely without risk. Cetirizine can still cause drowsiness in some people, and alcohol may make that worse. Loratadine carries a lower risk, though individual responses vary. Fexofenadine tends to have the lowest interaction risk of the group, but caution is still advised, and you should speak to your pharmacist or GP before combining it with alcohol. No antihistamine gets a free pass. It's also worth checking the labels on any nighttime or combination cold and flu products you might be taking. These often contain sedating antihistamines, so the same warnings apply. There's another category worth mentioning: topical treatments. Corticosteroid nasal sprays and antihistamine eye drops work locally with very little absorption into the bloodstream, so their interaction risk with alcohol is much lower. If you're managing mild seasonal allergies, these might be worth discussing with your doctor or pharmacist. One group who need to be especially careful is older adults. As we age, our bodies process both alcohol and first-generation antihistamines more slowly, meaning the sedative effects last longer and hit harder. This raises the risk of falls, confusion, and other complications, so if you're caring for an older relative who takes antihistamines, this is really worth being aware of. On driving and operating machinery, this is non-negotiable. It is illegal in the UK to drive while impaired, and the combination of sedating antihistamines and alcohol can absolutely constitute impairment. The same applies to operating machinery. Even if you feel fine, your reaction times and coordination may be significantly affected. Please don't take that risk. So, what can you do practically? Have a conversation with your GP or pharmacist about which antihistamine you're taking and what the specific guidance is for your situation. Always read the label and the patient information leaflet. If it says avoid alcohol, that guidance is there for a reason. And when should you seek urgent help? If you or someone else experiences severe drowsiness that you can't rouse them from, difficulty breathing, or signs of a serious allergic reaction, such as swelling of the face or throat, a rapid heartbeat, or feeling faint, call 999 immediately. Don't wait and see. To recap, first-generation antihistamines and alcohol are a high-risk combination. Avoid alcohol entirely. Second-generation antihistamines carry lower but still real risks. Check your labels, including on combination products. And if you're unsure what's right for you, speak to a healthcare professional. Remember, this video is for general information only. It doesn't replace personalized advice from your GP or pharmacist. If you found this helpful, give us a like and subscribe for more videos from Bolt Pharmacy. We'll see you in the next one.